Hello everyone, good evening. My topic was all about gamma glutamyltransferase. So, so, gamma glutamyltransferase or GGT is an enzyme involved in the transfer of the gamma glutamyl residue from gamma glutamyl peptides to amino acids, H2O, and other small peptides. So, in most biologic systems, glutathione serves as the gamma glutamyl donor. It is when glutathione with amino acid is attached to glutamyl peptides plus L-cysteinylglycine that will reduce into gamma-glutamyl cysteinylglycine. So, since GGT has not been clearly established the specific physiologic function, so it is suggested that GGT is involved in peptide and protein synthesis, regulation of tissue glutathione levels, and the transport of amino acids across cell membranes. So for the tissue source, GGT activity is makikita siya primarily in tissue of the kidney, brain, prostate, pancreas, and liver. The clinical applications of assays are confined mainly to evaluate the liver and biliary system disorder. Diagnostic significance. So in the liver, GGT is located in the canaliculi of the hepatic cells and particularly in the epithelial cells lining the biliary ductus. Because of this location, the GGT is elevated in virtually all hepatobiliary disorders, making it one of the most sensitive of enzyme assays in these conditions. So the higher evaluations are generally observed in biliary tract obstruction. So within the hepatic parenchyma, GGT exists to a large extent in the smooth endoplasmic reticulum and subject to hepatic microsomal induction. So the GGT levels will be increased in patients receiving enzyme-inducing drugs such as warfarin, phenobarbital, and phenytoin. Enzyme elevation may reach levels 4 times ULN. Because of the effects of alcohol on GGT activity, elevated GGT levels may indicate alcoholism, particularly chronic alcoholism. So, GGT assays is useful siya for monitoring the effects of abstention from alcohol and ginagamit din siya sa mga alcohol treatment centers. So, the levels usually return to normal within 2 to 3 weeks after cessation, but tumataas uli siya if alcohol consumption is resumed. Because of the susceptibility to enzyme induction, any interpretation of GGT levels must be done with consideration of the consequent effects of drug and alcohol. So, GGT levels are also elevated sa mga conditions such as acute pancreatitis, diabetes mellitus, and myocardial infarction. For the GGT activity is nagagamit siya for differentiating the source of an elevated ALP level because GGT levels are normal in skeletal disorders and during pregnancy. This is particularly useful in evaluating hepatobiliary involvement in adolescents because ALP activity will invariably be elevated as a result of bone growth. So the most widely accepted substrate for use in GGT analysis is the gamma-glutamyl para-nitroanilide. So the gamma-glutamyl residue is transferred to glycine, releasing para-nitroanilide a chromogenic product with a strong absorbance at 405 to 420 nanometer. So, yung reaction is magagamit siya as a continuous monitoring or fixed point method. So, dito naman tayo sa source of error. The GGT activity is stable with no loss of activity for 1 week at 4 degrees Celsius. The hemolysis does not interfere with GGT levels because the enzyme is lacking in erythrocyte. For the reference range, GGT male is 6 to 55 unit per liter for 37 degrees Celsius, and for the female, 5 to 38 unit per liter for 37 degrees Celsius. So the values are lower siya sa mga babae, presumably because of suppression of enzyme activity resulting from estrogenic or progestational hormones. So it ends my presentation. Thank you.